You are over 60, and at some point, between a blood test and a new prescription, maybe you asked yourself, does my intimate life still matter? I am a urologist, and what I'm about to show you might change the way you see something most men ignore or feel too ashamed to talk about. But the truth is simple. Oral sex, when practiced with care and consistency, still has a deep impact on the male body, even, or especially, after 60. Yes, you heard that right. Oral sex does real things to your body, good things. And no, this is not an exaggeration. It is not a metaphor. It is circulation. It is erectile response. It is self-esteem. It is physiology working as it should. And I know this because I've seen it happen, not in some distant clinical study, but right here, in my office, with ordinary men. Men who discovered that even after 60, there's still a kind of touch that can reactivate their body, restore confidence, and awaken something that felt lost: vitality. If this topic caught your attention, it's because you already sense that this video goes way beyond what people usually say out there. So, before we continue, make sure to subscribe to this channel. Here we talk about male intimate health with truth, no fluff, and solid medical grounding. Now tell me something. If you believe that intimacy can improve your health, write the word life in the comments. But if you still have doubts, or you've tried and felt no difference, write the word search. I want to understand where you are in your journey. The problem doesn't begin with desire or with the mind. It starts in the tiny blood vessels where circulation flows. After 60, those vessels lose flexibility. Blood pressure changes. The flow decreases. And what once happened naturally now requires a different kind of trigger. Hormone production slows down. Nerve signals travel differently. Sensitivity changes. And your body starts operating under a new code. Slower, more selective, more sensitive to time and type of stimulation. That doesn't mean failure. It means the system is asking for a new kind of attention. If pleasure used to depend on intensity, now it depends on consistency. And oral sex fulfills that role precisely. It gently stimulates circulation. It respects the body's rhythm. It reawakens connections that are still there, just dormant. That's why many men, once they return to this practice, report improvements far beyond pleasure. They feel alive, connected, present in their own bodies. If this explanation helped you understand what's happening with you, leave a like on this video. That small gesture helps spread reliable, useful information to other men going through the same stage. He was 68, a widower for some time, living alone, and dealing with all the usual signs of aging: blood pressure meds, sleep issues, and the feeling that his body was no longer an ally. When he came into my office, he didn't ask direct questions. He spoke carefully, almost apologizing for wanting to know what was still possible in terms of intimacy. He said, with some embarrassment, that he had reconnected with an old friend. The two of them were slowly rediscovering closeness, touch, and small gestures. And then, he shared something he hadn't planned to say. After a more intimate moment involving oral sex, something happened. It wasn't just pleasure. It was a reaction. His body responded with strength, as if it had been waiting for exactly that kind of touch for years. He described the feeling with simple words I'll never forget. It felt like someone turned on a light inside my body. No new medication, no change in lifestyle, no magic formula. The only new element was that moment of intimacy. Real, unhurried, respectful touch. And the body, which had seemed switched off for months, responded as if it remembered exactly what to do. This was not the only story. Over time, other men described similar experiences, a sense of reconnection, as if intimacy had pressed a hidden button inside them, one that was dormant, but not lost. And that's something we often forget. Even with age, the male body doesn't lose its ability to respond. It just demands something different, something more human, more direct, more subtle. That's where oral sex shows its true power, not just as a source of pleasure, but as a genuine physiological trigger. This is not about miracles. This is about biochemistry, real touch, stimulation that brings response, a body that, when treated with care, still knows how to react. If this is making sense to you, if you realize that your body still responds, but needs a new kind of stimulation, then it's time to go deeper. In my digital book, titled Rediscovering Intimacy, Healthy Sexuality After 60, I explain, in detail, what many men discover too late, that pleasure does not disappear with age, it simply finds a new path. And once you understand that new path, everything starts to flow with more confidence, more connection, and less frustration. You'll find practical, physiological, and emotional guidance to help you restore desire, overcome common challenges of mature intimacy, and make your intimate life lighter, healthier, and more fulfilling. The link is in the first pinned comment. Click, read, and learn how to care for your intimate life with the same attention you give the rest of your body. Because the human body doesn't rely only on strength, it also runs on chemistry. During oral intimacy, something happens that goes far beyond physical contact. As the mouth stimulates, the brain steps in and begins to release a precise sequence of commands, as if activating a silent but powerful emergency system. The first substance to appear is nitric oxide. Small, invisible, but essential. It is responsible for dilating the blood vessels. It is like opening the gates of a river that has been held back for far too long. With the flow restored, blood starts to circulate more freely, even in areas that had been receiving less and less stimulation. But that is not all. This type of stimulation, intimate, direct, filled with intention, does not only activate the circulatory system, it reaches the autonomic nervous system, the one that works without our control, regulating everything: heart rate, blood pressure, breathing, and libido. And when this system is touched the right way, it responds with precision. The nerve endings in the intimate area send strong signals to the brain, especially to the hypothalamus and the limbic system, areas responsible for pleasure, memory, and reward. In response, the brain releases dopamine, the neurotransmitter of motivation and energy. Soon after, it releases oxytocin, which strengthens emotional bonding, reduces stress, and creates a deep sense of comfort. It is as if the body says, "Here, I am safe. Here, I can function." What is most interesting is that in older men, this chemical circuit remains fully active. It does not vanish with time. It only needs to be reminded how to work. That is why, when oral intimacy is practiced with respect, care, and consistency, it is not just physical stimulation, it is a chemical reset, a reminder to the body that it is still worth responding, that pleasure is still possible, real, and healthy, even after 60. Some men train their bodies, others train their minds, but almost no one talks about training their own intimacy. In my office, an older gentleman once said something I will never forget. "Doctor, my partner became the physical therapist for my manhood." He said it laughing, but behind the joke was a truth few people understand. What he called a joke was, in fact, a real physiological concept. Intimacy, when experienced with frequency and quality, becomes functional exercise. And oral intimacy, in this context, plays a specific and irreplaceable role. Unlike other forms of stimulation, it requires passive surrender, breathing control, and a gradual rise in arousal, all without causing unnecessary muscle tension. In other words, it trains the body without harming it, like guided stretching, like a well-directed blood flow. When this happens regularly, the tissues in the intimate area stay oxygenated, the muscle fibers remain active, the nerves keep communicating with the brain, strengthening the response circuits. It is like keeping a road open. The more it is used, the more free it becomes. Now, when the body goes too long, without this type of stimulation, a slow process begins. Collagen starts to build up in a disorganized way. The flexibility of the tissue decreases, and what once responded with ease begins to react with stiffness. Not the desired kind, but the kind that limits, tightens, and hardens from within. That is why many men who return to intimacy after a long time of abstinence report a strange physical sensation, It felt like something unlocked. It is not just a feeling. It is biology reorganizing itself. Oral intimacy, when practiced with care and regularity, works like a silent gym. No weights, no mirrors, only touch, patience, presence, and consistency. And maybe at 60 or 70 years old, that is exactly what the body needs. Less pressure and more of the right kind of stimulation. There is something that might be happening to your body right now, and the most concerning part is that it does not hurt. It gives no clear warning. It does not alert you. It simply progresses quietly. It is called penile fibrosis. And contrary to what many believe, it is not rare, nor only linked to trauma or surgery. It can also appear simply because there is no use. Yes, the prolonged absence of stimulation in the intimate region, especially in men over 60, can lead to disorganized collagen buildup inside the corpora cavernosa, the structures responsible for erections. The result? A slow loss of internal elasticity. Erections become harder to achieve, shorter, and less firm. And over time, in some cases, abnormal curvatures, discomfort, and even partial rigidity at rest may appear. All of this can happen without the person even noticing when it started. Because fibrosis does not begin with pain, it begins with silence. It is as if the body is trying to preserve a function that stopped being used, like a muscle that starts to waste away without movement, or a hinge that rusts from lack of use, slowly, until it eventually locks up. But the most surprising part is this. In many cases, this process is reversible in the early stages, and the key lies in stimulation, not aggressive, forced, or mechanical stimulation, but regular, respectful, consistent touch. Oral intimacy, in this sense, is not only about pleasure, it is physiological prevention. It stimulates blood flow, mobilizes tissues, keeps the corpora cavernosa oxygenated, and activates the nerves that help maintain muscle tone in the intimate region. It is the kind of gesture that, when repeated, often prevents time from turning into stiffness, not just in the body, but in how a man sees himself. Because when the body loses flexibility, the impact is not only physical, it affects self-esteem, confidence, and the desire for connection. And slowly, a man begins to believe that intimacy is part of the past. But sometimes, what stayed in the past was just the habit of allowing the right kind of touch. Most people associate saliva only with taste, but the truth is, this simple fluid, often overlooked, carries powerful functions when it comes to intimate health. During oral intimacy, saliva is not just there to ease the contact. It actively takes part in the process, not only in excitement, but in the physiological protection of the skin. As we age, the skin in the intimate area also changes. It becomes thinner, more sensitive, less protected. The natural production of oils decreases, and the barrier against microorganisms weakens. This is where saliva shows its true value. It contains enzymes like lysozyme and proteins with antimicrobial action, which help balance the local flora and fight off harmful bacteria. It also provides temporary moisture, easing dryness, reducing friction, and preventing tiny cracks, the kind you cannot see, but that can allow infections in. And this is not just theory. I have seen patients who, after improving hygiene and returning to regular intimate practices like oral intimacy, reported less discomfort, fewer inflammations, and much more confidence during contact. In this scenario, saliva becomes an ally. It protects, hydrates, and prepares the skin. And when this is done with mutual respect and care, the result is not only pleasure, it is preventive health, disguised as intimacy. Few men know this, and many go through life thinking they are losing something, when in fact they were never told the power that certain gestures hold. And that is exactly why this channel exists. If this video brought you knowledge, clarity, or even hope, subscribe now. There is much more waiting for you, always with responsibility, science, and respect. And if this content helped you in any way, leave a like. It helps this message reach more men who also deserve to know all of this. And of course, explore other videos on the channel. You will find topics that maybe no one ever explained, but that can make all the difference. A warm hug, and see you in the next video.